Well, good afternoon, everyone, and thank you for joining me today for another Leadership Dialogue session. I'm Wright Lassiter. I'm the CEO of Common Spirit Health, and I'm also the 2022 Board Chair of the American Hospital Association. I'm really looking forward to our conversation today as we focus on a really critical and serious issue that's facing our field, and that is the tremendous financial pressure being felt by hospitals and health systems across the United States. I'm hearing from many colleagues and more stories and seeing startling research and data that are all painting a relatively grim picture. The reality is that the first half of 2022 has severely tested our field due to the impacts of COVID surges, increased expenses, and lack of additional COVID-19 relief funding. I'm sure you've seen some of the reports in August from Fitch Ratings stating that the outlook for nonprofit hospitals is deteriorating, and made the point that hospitals are being squeezed by expenses, increasing expenses due to labor, due to supplies, general inflation, and also investment losses. Last month, the American Hospital Association issued a report on how delayed and avoided care has contributed to increasing acuity, which is driving up, again, increases in labor, drug and supply costs, and putting further pressure on hospital finances. And just this month, AHA released new data from Kaufman Hall and Associates stating that even under the most optimistic projections, margins for 2022 will be down 37% compared to pre-pandemic levels, with more than half of hospitals operating in the red. And under a pessimistic scenario for the rest of 2022, margins could be down as much as 133% when compared to pre-pandemic levels, with over 2/3 of U.S. hospitals operating in the red. That report said that these trends are expected to continue throughout 2022, with losses in the billions of dollars for hospitals and health systems, resulting in the most financially difficult year for our field since the beginning of the COVID-19 pandemic. While the commitment and mission of hospitals and caregivers has never wavered during the pandemic, there's also no disputing the immense strain that the pandemic has placed on hospitals and health systems. And if left unaddressed, these financial challenges have the potential to jeopardize access to essential healthcare services for patients across the country. These are difficult times indeed, and difficult conversations to have. But I'm grateful to have a hospital leader join me today to talk about the reality of what her organization is facing and how these financial pressures will impact her patients and her community. I'm pleased to introduce Peggy Abbott. Peggy is the president and CEO of Ouachita Medical Center in Camden, Arkansas. Ouachita County Medical Center is an 80-bed acute care hospital with a level 4 trauma center designation, offering coordinated care across their service area. Peggy has been with her organization for 35 years and was named the president and CEO in 2013. She also serves on the American Hospital Association Region 7 Policy Board and was the 2015 recipient of the association's Grassroots Champion Award. Additionally, Peggy serves on the boards of the Arkansas Hospital Association and the Arkansas Rural Health Partnership. So join me in welcoming Peggy, and let's dive right into our conversation. Peggy, thanks for joining me today.
Thank you for having me.
You're very welcome. So I gave a little bit of a preview of challenges that our field is facing. Maybe you could just share a little bit with us about your hospital, about the community you serve, and about how your organization has been impacted by the pandemic.
Well, certainly, as with hospitals nationwide, here in Camden, we feel the same pressures and constraints that all hospitals are reeling under currently in today's environment. As you stated, I've been in healthcare for 35 years, and these are certainly unprecedented times with the cost of operating, the inflation rate that's impacting our households, I shared with someone earlier, is also impacting our hospitals, the cost of labor, all of those challenges. We have been in existence, as you stated, for quite some time. There's been a hospital in Camden for 99 years. For 70 years, we've been situated right here on this hill along the banks of the Ouachita River in Camden, Arkansas. Ours is a very underserved community. We fit that classification entirely. Of course, we have a hefty middle class population and some upper class, but predominantly a very underserved and a poor area. We serve a 55-mile radius. Our community, our town, has a population of about between 12 and 13,000 now. It's been a steady decline, as is happening with so many of the rural communities and the towns in those rural communities. We also have on our fringes a major defense industry is based here, and that industry depends upon our hospital being here to secure government contracts. But most importantly, we are here to affect the lives of our community. And those are the faces that drift before us as we confront the challenges and confront the criticality of what the loss of our hospital would mean, certainly to this county, to this community, to this region of the state, the impact of the loss of jobs. We supply more than 400 jobs in this community. And although we are a small rural facility, we make a $52 million impact economically in this area. So we're vital to the economic standpoint of the community. But the primary reason that we are here is to affect changes in lives, to affect their availability, their accessibility to health care, and to be here in the middle of the night when that person needs care. And the reality of driving 2 hours away to another hospital is, it's just difficult to think of that happening.
Well, as you share that story, unfortunately, that's a story in many, many communities, in particular in rural communities that have the full strata of our humanity. Some upper class, as you described, some middle class, but a large number of folks who are vulnerable and who really count on and need the access that you provide. Peggy, we know that financial pressures continue to mount as we come out of COVID. Can you share a little bit about the increased financial pressures that your medical center is facing? And I'd be particularly interested in understanding if these are new challenges or existing challenges that have now become more exacerbated as a result of COVID-19 pandemic.
There has certainly been an exacerbation of some pre-existing situations. Being a small rural hospital, we of course have never had a hefty amount of reserves on standby. And as we began to confront the decline in revenue through the decline in census during the time of COVID-19, it certainly impacted our financial viability. Going back to March of 2020 is actually when the first COVID case was diagnosed in Arkansas. We immediately were instructed to cease all elective procedures. Elective doesn't mean that procedure is not needed. So our hearts went out to the patients who maybe were in pain and needed something like a knee joint replacement or a hip replacement. But we suffered from that immediate cut into our revenue. When you don't have patients coming in the door, if there are not patients in the beds, there's no money coming into the hospital. And although there was monies that came forward during COVID-19, I like to stress over and over that the viability of a hospital does depend upon the patient load that's coming in the door. When we had to cease some of those routine procedures, it made a definite impact. And even the fact that people were frightened to come to the hospital. If you recall, throughout the nation, people were staying away from a hospital because they were so fearful that they would catch COVID-19. And in those early days, the death rate was just devastating. It took quite a while for people to return. And I have to be quite frank in saying, among my colleagues here in Arkansas, we use the phrase rebounding from COVID. We have not rebounded from COVID. Our census days remain lower than pre-COVID. And those census days remaining lower certainly impacts the financial livelihood that we have here. So it's been one of the most devastating, heart-wrenching, challenging, interesting, fascinating, all of those words you may want to say, as strategizing in healthcare administration. We have sustained a loss of one service that was very heart-wrenching to us. As you hunker down and you try to protect the mothership, which is the hospital, we had to make the heart-wrenching decision to close a rural health clinic that we had operated for 25 years. But we could no longer justify the loss that it was incurring and putting another service right here at the hospital at risk. We're trying to dig in and keep all of the service lines operating and available to our community, because as you would know, we are the safety net for our community. We not only operate the hospital, we have an urgent care clinic that is so critical to so many individuals who maybe don't feel that they have access to another clinic. So we're trying to survive the cost of increased cost in labor. The contract labor force has hit us negatively, as it did every other community. And that shortage of staff is a very detrimental impact to access of care, because, you know, if we don't have clinical staff on the floor, we can't have patients in the bed. And it's just a very unique, challenging time to keep a rural hospital afloat. You probably know that rural hospitals operate at a lower cost reimbursement by Medicare anyway. And when you have an impact to that census, and we have definitely had an impact to that Medicare census, it has a bold effect to the financial status of a hospital. We are committed that, however we have to figure it out, we will keep this hospital here. That's our goal. But regrettably, as we know through closures of hospitals, rural hospitals throughout the nation in the year 2020 in particular, we may have a goal, but you have to have the revenue and the cash on hand. More important than just a revenue stream coming, the cash in the bank is what we have to keep these hospital doors open for our community.
Well, first, let me just applaud you for the way you are leaning in to putting your best effort and best thinking towards meeting the community's needs. You described in your prior response that you all had to close a service that you've had for a period of time that was heart-wrenching and gut-wrenching, but nevertheless, you had to make that decision. And so certainly appreciate the difficult decisions that we're all having to make, whether it's service closures or reductions in staff or other kinds of things. Just sort of curious, are there other steps that you think an organization like yours may have to take to ensure that you have financial stability both in the short run and the long term? Because we are certainly hearing of challenges across not just the rural hospital community, but the entire field. Curious, are there other steps that you all are giving consideration to help support your short and long term financial success?
Well, absolutely. And you touched on something that I've been advocating and stressing, and that is a lot of times we think, well, it's a rural hospital, and if it had to close, we'll figure out something. There'll be the big hospitals. But when we see the huge losses that many of the health systems are posting year to date, that should sound the alarm throughout the powers that be, that the healthcare system in America, as we know it, is very vulnerable if some steps aren't taken to turn this tide of lower reimbursements as compared to the high cost of operations. And what we have done, certainly more than the closure of that one clinic, before we even did that, many of us did a voluntary wage reduction. And I was the first one. That started back in the spring when I realized that things were happening and you want to keep the hospital afloat. So I stepped forward and did a voluntary wage reduction, even made a reduction in the hours that I was paid each week. And I'm not saying that to draw attention to me, because many of our managers did absolutely the same thing. We made the difficult decision to do a mandated reduction of hours in the non-clinical departments, asking people to shorten their work days by anywhere from 1 to 2 hours a day. And, you know, that's a painful decision to have to make, because you're touching the lives and the paychecks of some individuals who are making minimum wage, $15, $16 an hour. And when they step back and get paid 10 hours less a pay period than they're accustomed to, that's a very difficult thing to do. But we have a committed group of individuals here who have done that without complaining. Of course, on the clinical side, you staff based upon the patient needs, so those hours are sometimes automatically reduced anyway. And we're just looking at every supply cost. We're looking under every rock to see, is there somewhere that we could change a dollar, doing a lot of our contract comparisons. Very, very definitely putting steps into place. In fact, a major part of today has been our analyzing our expenses this month currently and saying, is there any fluff that we could have cut out? And I would like to say that often I'm hearing throughout the nation, there's the whisper of, well, perhaps if they managed better, the money would be more balanced. And I think that hospital administrators are operators. We have operated hospitals for years and years, and it certainly just has come down to the fact that the money that we're bringing in is not equalizing the money that we're having to pay out for higher than ever cost of labor, in addition to the supply cost.
Right.
This year to date, we've been paid with the Medicare accelerated payment take back. Our Medicare payments are equivalent to 19.7 cents on a dollar. Is there a retail business anywhere that could provide something for sale and say, it's okay, you only have to pay me 19.7 cents on my cost of this item? So healthcare is very unique, but it's a very well-run system in America. I just think that we are certainly at risk in America, not just the small hospitals. We need to be paying attention to what's happening with the large systems also.
Well, let me just say first that I really appreciate all the effort, again, that you and your colleagues in Ouachita County are applying to ensure that your medical center remains viable. I think the points you raise are really spot on. Part of what the AHA continues to do on behalf of America's hospitals and health systems is advocate for us, because honestly, we need voices, frankly, resonating in every state house and in Washington, D.C. to let legislators know what's going on. And I would just say that, during my time as the board chair here in 2022, we've been very focused on trying to ensure that we can support AHA's focus on advocating for the financial sustainability of hospitals, particularly rural hospitals. And unfortunately, as you commented, this is a complex issue. There's no magic bullet. We all wish that there was a magic bullet that could solve all of the challenges, but there aren't any one solution to addressing financial sustainability for our hospitals. So I'm just sort of curious, from your point of view, do you see any particular policy changes that you would like to see put in place that could provide greater sense of financial stability, particularly for America's rural hospitals? Are there some things that you think that can happen that could help our field weather the current unsustainable financial pressures that we're all under? I'm just curious about your thoughts there.
Well, there certainly are. And I will echo your comments. I so deeply appreciate the American Hospital Association and its efforts on behalf of all hospitals. They have advocated for rural hospitals, and I'm deeply grateful for that. One thing that we're advocating and pushing for is the continuance of the low volume adjustment. That is so critical to the small hospitals. It must stay in place. I would like so much to see the complete abolishment of sequestration, that be removed from the timetable of every hospital, because that definitely is a blow. I think behind the scenes, oftentimes legislators don't stop to appreciate all of the quality initiatives that have been put into place, which I advocate for those. The patient safety is of utmost importance in most every hospital, I think. But there continue to be the mandates of the directives that we have to meet. And it's not that we get rewarded for meeting those initiatives. It's just that we avoid a penalty. Perhaps there could be a better way for us to gain some ground with reimbursement for those who actually do meet those initiatives. And as you said, it is not an easy change to orchestrate. We have reached out to our Washington delegation, our state delegation, and our governor, as well as had some conversations with Department of Human Services. representatives. There must be some adjustment made to the Medicare reimbursement rate for every hospital in America. The rural rates need to be higher, and those rates must be raised on a regular basis to stay in line with inflationary increases as well as the supply chain and the increases in supply chain. That has to happen. I think that could happen. I think that's a change that would not be that difficult to orchestrate. It's just getting the right attention on how critical it is to have those funds available. On the state level, which of course some of that trickles down from federal money, the Medicaid reimbursement rates also have to be looked at. Our Medicaid reimbursement rate is so incredibly low. We were trying to decide this morning, when is the last time that we've had a Medicaid payment rate? And I know mentioning money is not always popular, but our daily rate for a routine Medicaid patient is $750. Equate that to the cost of providing the care for that person. And that is certainly a population that we're going to take care of. We're going to continue providing care to that individual. I also have had some conversations with the leadership among some of the major commercial insurance providers. There's one major provider that Arkansas is 49th out of 50 in the lowest reimbursements that insurance company gives to hospitals and healthcare providers. And so I think it's just important that we need the association advocating for us, but we who are in the trenches and on the inside have to be willing to be more transparent and share the true story of where we are. I was alarmed 3 or 4 months ago in particular. And because I cared deeply for the hospital, I just decided it's irrelevant to me whether one thinks I'm a good manager or not. I need to share this story with someone. So I called our local representative, and he then began to fan the flames, and it reached the governor's office. And we now have had multiple conversations with different principals of, quote, the powers that be who can intervene and help orchestrate this change, because hospitals are too important to every community to let any hospital fail. We need every hospital for the sake of our life in America, the quality of life that people need. We need the underserved communities to not have to stay home and become so critically ill. You know, I shared that we provide the only ambulance service in our county. And I shared recently before a legislative body that I think of the non-English speaking individual, a young mother who appeared in our doors with a sick child. What would have happened to her, a person who had no transportation of her own, had we not been here? And I think that story resonates throughout America. It doesn't, and even the English speaking person, but I think of the challenges to those who are having challenges communicating with us. Thank goodness we had a community hospital here ready and able to help. You know, at the end of every day, and I state this to our organization, none of us would be here were it not for a human life that needed us. Whether it's our business office, our human resources department, we are all serving those patients. And I know that this is more emotional than a lot of people like to get. But I would say to anybody, whether they are in positions of power to help orchestrate change or to the everyday citizen, at some point in every individual's life, whether it's at the time of birth, at the time of death, or somewhere in between, most all of us at some point need a hospital, or someone we love needs a hospital. How tragic it would be if individuals in America had to stay home and suffer or die from lack of access to care, when we have the power within us in America to make the change that needs to be done. I just think that those who can help make it happen need to toughen up and help us make it happen, because that H in every community matters.
Well, I really appreciate this dialogue. I get to this point in every one of these dialogues where I have to say I need to be mindful of our listeners' schedules. So I think we'll stop here today, not because I want to cut the dialogue off, but knowing that that frankly our leaders and team members who watch these dialogues have a lot of work to do, as you've just described.
Yes.
But as you all just heard, our field is facing significant challenges, and for many, they're unsustainable. Yet, as Peggy so poignantly described, there's a need for that H in the communities across the country, and we've got to make sure that we have financially sustainable, viable H's to provide the critical services. Certainly, as we mentioned, AHA is working hard to bring the severity of our current crises to the attention of those who need it. Just as Peggy said, it'll be great to make sure that we deliver the messages and then that those who are in power are willing to step forward. But we will continue to share these messages with policymakers, with the public and the media. And I would also say that as you listen to this dialogue, we urge you to share your story, your specific local story with your legislators, policymakers, regulators, and friends and family. It's important that we make a very, very clear connection between the numbers and the real impact that the financial losses can have on our ability to provide care. Peggy, I want to just thank you so much for being part of this dialogue today. As I said previously, greatly appreciate you sharing your experiences both from your heart and your head, and the insights from someone who is working hard to make sure that her community has the needed critical services necessary to ensure that you have a healthy community. Until next time, thank you everyone for joining us today on Leadership Dialogue, and I hope you'll be back next month for our next dialogue. Thanks very much.